Welcome back to Try It Today. I'm excited about this next guest. She does fine work in the community throughout the area, and I want you to meet her right now. She's our special guest, Marlene Baruch. She's a RN, MSN. She has many titles, wears many hats, but for today, she's a breast cancer educator with Piedmont Comprehensive Women's Center of Service of Cornerstone Healthcare. Marlene, how you doing?
Good. Thank you.
Good to see you.
Thank you.
I guess my first question is kind of obvious. I want to know, what does a breast cancer educator do?
Okay. I work with all of our women who are diagnosed with breast cancer. Hopefully, I meet the lady when she has her breast biopsy, and then she finds out that she has breast cancer. And I am with her throughout the journey that she makes, from the time she's diagnosed, when she has her surgery, her treatment, whether it be chemotherapy, radiation. I don't mean that I'm physically with her at all of those times.
No, but she can count on you being there. It's, man, that's just amazing, because there's so many things that go into this other than just the physical parts of it, the emotional, and it's almost like you need to be a friend and a counselor. I mean, did you have to get special training over and above being a nurse to do this? Or? Well,
I have had some extended classes as far as breast cancer treatment and management of patients. And you're right. It is a large part of it is a friendship thing. We do become friends because I'm following them for months.
Yeah, and you're somebody they can count on. I just think that's a great way to do it, folks. It really is. And then the patient doesn't feel like a number. They feel like they've got you to rely on. Let's talk about genetic testing. I don't think I've ever covered this topic with anybody on the show. What kind of genetic testing do you do, and how long has this been available?
Okay, I do genetic testing for breast and ovarian cancer, for colorectal cancer, and for melanoma. But probably for today, you may want to know more about the breast and ovarian cancer. I've been doing this for 5 years. And of course, it was available sometime before that. I really can't tell you exactly how long, but I know we've been doing it at Cornerstone for 5 years.
And what do the results tell you? Let's say you're a breast cancer patient. I mean, what do your genetic tests tell you?
The test tells you a few things. It tells you if you have a gene that is mutated, which means a gene that has something wrong with it. It's not normal, and therefore puts you at an increased risk of breast or ovarian cancer.
All right, so let me back up, because I know I'm ignorant about this. I want to learn along with the audience. So this can be somebody that just goes in for a checkup or gets in touch with you and the folks at Cornerstone, and they can ask for this genetic testing,
they
or a
sure
doctor.
Can.
See, I didn't realize that. And then you can sort of let them know if they're predisposed and they need to watch this more carefully, right?
Exactly, exactly. There's some criteria that I look for, and maybe you're going to get around to wanting to know that.
There's no telling what I'm going to get around to. I mean, you never know with me. But we didn't rehearse this either, but I can't let you get away without this. There was some controversy recently about a study that was put in the New England Journal of Medicine about how, well, mammograms aren't as efficient as we thought. But, I'm thinking something's not right here. I mean, you still say that women ought to get mammograms, right?
Absolutely, absolutely. They should begin at age 40 and earlier if they have a strong family history, or obviously if they have a problem, they need to have a mammogram earlier, but at 40. It's surprising how many women we see that mammogram has saved their life.
Yeah, and now with what you're teaching me about the genetic testing, you've got a 1-2 punch to help you, because you can sort of see things coming and let's watch this thing closer, then get the mammogram, and then you say that can save a life. That's amazing. What future advances are we going to look at in this realm? Anything you can look in the crystal ball?
Well, I'm sure there are going to be more genes discovered that cause or increase the risk. Right now, we're only looking at 2, but there has to be more out there. That so women right now who may be tested and are found to be negative, even though they may have a very strong family history, maybe there's something else that we just don't know about yet. I think will be coming down the pike.
Well, yeah, and we need to look for that. Final thing I want to ask you before time gets away from us. The woman who's watching the show and says, "Look, I understand what you're saying, but I'm 42. I don't want to get a mammogram. I don't want to know."
Ooh.
What do you say?
I do hear that. I do hear that from patients. I say you really need to know, because it may save your life. Number one, as I said before, a mammogram is life-saving, and it's not that big a deal.
Yeah.
It really isn't.
I'll tell you what.
Women do complain, but when you weigh that to having breast cancer, I think you might want to have the mammogram.
Exactly.
It's life-saving.
Well, up here on the website you're watching on screen, www.cornerstonehealth.com, which has all sorts of good information for you. So does Marlene, and I really applaud you for what you do for your patients and for the community, and thanks for being such a good friend to so many people.
Thank you. Thank
Thanks,
you. Thank you
Marlene.
for having me.